I want to thank the Focused Ultrasound Foundation for this opportunity to present our experience with blood-brain barrier opening with focused ultrasound in patients with Alzheimer's disease. The funding of this trial was received from Insight Tech Inc. I am Vibhor Krishna. I'm an assistant professor of neurosurgery at The Ohio State University. Today we're going to be talking about the trial for A-beta plaque clearance in patients with Alzheimer's disease, the rationale for the study, the evidence of safety, trial design, the eligibility criteria, study procedures, outcomes assessment, and finally the current state of enrollment of the trial and some concluding remarks. In patients with Alzheimer's disease, the development of plaque buildup and cognitive decline are often seen in parallel. There have been trials that included strategies for immunization, both active and passive, with hopes for reducing A-beta plaque in patients with Alzheimer's disease. Several of the medical therapeutics were found to have less efficacy in plaque clearance because of blood-brain barrier. The safety of opening blood-brain barrier was established through a phase 1 clinical trial done in Toronto, where patients with Alzheimer's disease underwent opening of blood-brain barrier in a reversible way over time, over several cycles. This MRI shows the contrast T1 weighted image that does not have any contrast enhancement, and immediately post showing contrast enhancement, while closure of blood-brain barrier 24 hours post. So the clinical trial is enrolling patients with mild Alzheimer's disease who are male or female between the age of 50 to 85. They have a legally authorized representative. They have probable, the diagnosis consistent with probable Alzheimer's disease. And then there are several criteria based on different assessment tools, specifically the Mini-Mental examination, no less than 18 score, patient receiving a stable dose of medications. The beta amyloid plaque PET scan is done to ensure that there is a beta amyloid plaque buildup in the brain. Patients able to communicate sensation during the treatment and able to complete all the study visits. Now, as far as the exclusion criteria for the trial goes, there are several exclusion criteria, including imaging-based. Those include any evidence of active or chronic inflammation, acute or chronic hemorrhages, tumors, meningeal enhancement. Then on several scales, if patients meet certain scores, they make the patients ineligible. ApoE homozygosity, allergy to gadolinium, which is the contrast agent, and definity, which is the microbubble agent used to open blood-brain barrier. And then patient not having a reliable caregiver. The study procedures, we start with screening. There are several clinical assessments, and the important one is beta amyloid PET. After the patient has met the inclusion-exclusion criteria, we do blood-brain barrier opening in 3 separate cycles, if patient tolerates that, 2 weeks apart. So cycle 1, 2 weeks later cycle 2, and 2 weeks later cycle 3. And the targets in cycle 2 and cycle 3 are the same targets as cycle 1. And then there is extensive list of follow-up after opening blood-brain barrier in 3 weeks. The way we select target is based on of course, location. So hippocampus and entorhinal cortex were allowed to be the locations in the first phase, and now we are allowed to even open blood-brain barrier in different areas outside of the hippocampus in the brain. The way we select targets is based on the extent of amyloid plaque buildup, and we are choosing areas that are 15 to 25% more than the baseline in the brain for blood-brain barrier opening intervention. The primary outcome is safety, of course, based on clinical assessments, imaging assessments at different scales. And also, we are looking at the success of opening blood-brain barrier through contrast enhancement, and then preliminary efficacy through change in beta amyloid PET. Study oversight is provided by a Data Safety Monitoring Board. Currently at Ohio State, we have enrolled and treated 5 patients. Out of these, 3 patients have completed all 3 cycles. 2 patients have completed only 1 cycle. As far as the safety goes, we have not noticed any serious adverse events. 1 patient had reported a decline in memory, and the detailed neuropsychology assessment is pending for 1 patient. Now, as far as preliminary efficacy goes, we had evidence of BBB opening in all patients, in all sites where we opened blood-brain barrier. And reduction in amyloid between different regions was 1.6 to 15%. And we did not notice any differences between gray matter and white matter targets. This is a screenshot showing the dose overlay in the entorhinal cortex and hippocampal targets. Of course, the red color shows a higher cavitation dose, and the blue shows a lower cavitation dose. On the right side, we are showing the results of the dynamic contrast imaging, showing that in this area where we open the blood-brain barrier, at baseline, the contrast levels are low. As soon as we give the bolus of the contrast, there is an immediate peak, and then, of course, the fluctuations around that peak during the later runs. This is as compared to a control area where the contrast enhancement is negligible and doesn't show a peak. Concluding remarks. So this clinical trial aims to address a large clinical unmet need where there are no effective medication treatments. And of course, the long-term goal would be to combine blood-brain barrier opening with therapeutics that can improve our effectiveness for beta amyloid clearance. The challenges are that we are in early stages and determination of an optimal dose for the amyloid clearance is still unknown, and the mechanisms underlying amyloid reduction are yet to be defined. And we remain very optimistic about this clinical trial since it is geared to address a large unmet clinical need. We thank you for your attention.